I'm sure that all of you are very familiar with the word hypertension. So what does it mean? Hypertension means a high blood pressure. As per the World Health Organization definition, a blood pressure consistently more than 140 over 90 is classified as somebody having a high blood pressure. Hypertension has been a silent enemy in the sense that estimates suggest that at least 1 in 4 adults around the world have been diagnosed or suffer from a high blood pressure. What puts us at a high risk of developing hypertension? So, elderly age, genetic factors, our dietary habits, smoking and alcohol, overweight, and lack of exercise. All these factors put everybody at a very high risk of developing hypertension. So what can we do to mitigate these circumstances? Lifestyle measures are the most important ones. One is keep yourself fit and active. Recommendations suggest that we need to exercise at least 15 to 30 minutes per day for at least 4 to 5 times a week. Do not sit idle. Keep yourself fit and active. Cut down on your alcohol. Cut down on your smoking. Quit smoking altogether. Thirdly, a healthy diet fresh in fruits and vegetables is what is recommended. Diet rich in salt puts us at a very high risk of developing hypertension. Guidelines recommend that adults should not be taking more than 5 grams of salt per day. Indian diets particularly have a very high salt content. Most of the diets that put us at a very high risk of salt intake would be pizzas, burgers, and other items like chips, fries, and pickles, etc. So what sort of symptoms do you or can you expect if you have a high blood pressure? Most of the times, hypertension is asymptomatic in the sense that even though you suffer from a high blood pressure, you do not manifest any symptoms. Symptoms usually manifest if the blood pressure is too high, such as more than 180 over 120. So what sort of symptoms can you expect? Symptoms such as headache, nausea and vomiting, blurred vision, dizziness, and occasionally patients can also have chest pain as well. So these are the symptoms that highlight or that should trigger your thoughts with regards to a high blood pressure. So why is management of hypertension very important? Hypertension puts your heart, your brain and your kidneys at a very high risk of developing complications. So what is the ideal blood pressure? Anything less than 120 over 80 is recommended to be ideal. So finally, remember, the battle against hypertension is not won in a day. It is a conscious and consistent effort that decreases our risk on a day-to-day basis. Thank you.